Good morning, everybody, and welcome to the January Focus Friday. We've entered 2021. We're hoping for a different outcome from 2020. We started off January of last year with a tremendous promise and opportunity, and then in February and March it started going in a different direction. But we've got some good things happening out there in terms of vaccines, and we've got a statement. Our Focus Friday is presented by Novant Health Huntersville Medical Center, and we have a statement from Jennifer Husky from Novant, and I want to read it to you. She's not going to be able to join us this morning. Jennifer says from Novant, as our state and nation's pandemic numbers continue to rise, Novant Health has, since our last meeting, put in place an all-in initiative. In this way, all team members are working tirelessly to provide the highest level of care and making sure our resources of both people and supplies are well prepared. Novant Health continues to care for our community members in a remarkable way every day, in every dimension, every time. Although we can't be here in person on this call today, know that we will see ourselves through this pandemic together and hope to be back with you in person very soon. Jennifer Husky with Novant. I know we have Luke McDonald on the line as well from Novant. We appreciate the partnership that we have from Novant Health Huntersville Medical Center. Again, I'm Bill Russell, and I want to welcome everybody to the call today. This will be recorded, and we will place it on our YouTube channel and push it out through the Chamber's website and also the Chamber social media. We have Jeff Tart, who's again agreed to be our 2021 Public Policy Chair, and we put together a very aggressive legislative agenda that we'll be sharing with Senator Sawyer and the rest of our delegation in Raleigh very, very soon, as the board has adopted those policies. But I want to introduce Jeff so that he can introduce our senator, and Jeff will be emceeing today's program and then allowing for questions after that presentation. So Jeff, it's your show.
Thanks, Bill. Appreciate it. Good morning, everybody. Today we have with us Senator Vickie Sawyer. I think Vickie's a lifelong resident of the Lake Norman area and living in Mooresville. She, like a lot of us, is a small business owner, having her own insurance agency with her husband. I guess, Vickie, you're now starting your second full term. You're at 2+er, having been appointed in a prior term to fill a Senate vacancy. So I believe we are tremendously honored to have you here. You represent, again, the northern part of our business sector, being both Iredell and Yadkin counties, I believe, that you cover in the North Carolina General Assembly. Recently have just gone into session for the long session. I guess you all were just recently given and administer the oath of office. We'll be looking forward to hearing what's on your plate for the coming session. So with that, I will give you the floor. And again, truly appreciate you taking time out of your busy schedule to join us.
Oh, thank you, Senator. Thank you all for being here. And, you're in a dangerous spot. You have a politician in front of a mic, but I promise that I will not take too long. But I do want to kind of highlight a few things that are going on. And I really want to hear from you. So if you have a question during this and you have to have it answered, please just ask, interrupt and ask, because to me, this is more of an informal kind of talk. So I'd love to hear any of your input as we go along. Jeff's right. We just started our recent session, got our committee assignments, and I am my 2+er. Grateful for that, grateful for our area. I live in Southern Iredell, so I almost feel as if I have the Lake Norman community. Lake Norman is my community. So Cornelius and Huntersville, I do business in there. We have customers there, and it's just part of my world. So I feel like I'm more akin to you where I live than maybe some of the others because of just geography, and we face those same challenges. So one of those challenges that we've all faced, and especially with you folks who are on town councils, is transportation. Something I worked very hard to be a part of, and now very honored to be the co-chairman in the Senate for both the Transportation Committee, also the Appropriations. And you guys will talk a little bit in a little bit later. We'll talk some about what we have seen from the NC First Commission. But that is something I know that's very dear to all of our hearts, especially as business owners, because that is the lifeblood of a lot of our businesses. And it's something that touches all of our employees as well. So I worked very hard to get that committee appointment, and I'm just honored and grateful to have that opportunity. I'm also a part of the base budget. So that means, hey, when everybody comes in and presents and asks for money, I'll have one of those voices there. Commerce and insurance, this is my second term. Jeff mentioned I'm an insurance agent. And so that very happy to have that expertise or subject matter expertise to a difficult subject that everybody agrees is not fun to pay, but we're glad to have it in case there's something happening. So I'm grateful to be able to lend, my professional work into that environment to help maybe make some policy that will affect us all positively in the insurance and commerce field. Education. Big one, huge one. I'm sitting on that. Some people know I was trained as a teacher. I started in politics, advocating for public education, something near and dear to my heart and something that touches all of us and something that's really in dire needs of some help. And also finance, which is one of the least favorite because that's how you get your money. And so that's the committee I'm on. And we are led by another close to Charlotte, Senator Paul Newton, who's just a class act. And he is amazing at that. And so I'm grateful to be helping him on that finance committee. So those are my committees and what we have. And those committees, of course, were able to be chairman because in North Carolina, the Republicans were able to hold on to the majority in the Senate, and they actually picked up several seats in the House. So whereas some faces may be different, some things politically are the same. We have a General Assembly that's controlled by the Republican Party. We have an executive branch that is controlled by the Democratic Party. We now have a judicial branch that has as its top officer is Republican Paul Newby. So there's going to be a shift in that judicial branch, although in the Supreme Court, we have a little bit better I wouldn't say levity, but we have a little bit better mix of Republicans and Democrats on that, so that, not that should affect or does affect any judicial outcome of their party affiliation, but it does kind of help to level the balance of the playing field when you have more of a mixed and balanced board. So politically, we're kind of where we were, except for in the judicial branch. So you're going to still see some of those same policy discussions come up, and they always come up. And that's just, we should openly discuss those because that's how we get better policy. So that is kind of where we are in North Carolina. And I'm going to keep it focused on North Carolina because that's my lane. I'm going to stay out of the federal stuff because that is just not my lane. I don't think that does anything to further the conversation of, what we're going to do today as small business owners. One thing that is set in a 4.5-hour meeting, Jeff, you remember those days, and we discussed and had Dr. Mandy Cohen, who is the leader for our Department of Health and Human Services here in North Carolina. I think we all have seen her on TV talking about COVID and Corona. And that meeting was about the vaccination distribution. And I know you said we have Novant on there. They know this all too well. We rank 44th out of states in our distribution. And arguably we have a very serious problem. The Hospital Association actually presented, and they had some real trouble findings. And it all comes down to really this. When the Health and Human Services decided to do their vaccination rollout, they chose not to use the federal platform for their IT because they felt like it wouldn't integrate into our health insurance exchange or our systems. And they also chose not to use a system that's already set up called the Health Insurance Exchange. They chose to build a new platform to try to integrate. Well, I don't know, but in my business, when we ever do a new platform of anything, it never works well. And so when you built this new platform and now you're doing the largest vaccination to scale, it's inherently going to have problems, and that's where we're at. I mean, the Hospital Association was saying how they have to do double entry. So someone comes in, they get their vaccination. It takes them 20 minutes of computer seat time to enter in that information. So if it takes them 20 minutes to get one person vaccinated and a person's working an 8-hour day, I mean, that's only 24 people a day they can get vaccinated just because of the backlog with the system. So there is absolutely legislative oversight asking that agency to do better with that. So that was heard loud and clear. They say they're going to continue to do updates. Honestly, I don't know where it's at, but that's been just very disappointing. So I know that they're going to continue to work, but we still rank near the bottom. So we as legislators, again, we work on the funding for them. We don't do the policy, but we hear everyone loud and clear. And we know we got to do a better job. So that is my vaccination discussion, but this is moving more forward towards like policy area. And guys, we're talking a little bit about education. I think we all know the struggles, especially for our employees who have young children that are in school age, or people like me who have school age and children. it's difficult and it's affecting everyone, but it's actually affecting women in the workforce more. And you're seeing that folks whose businesses are being shuttered a lot of times are women, and the onus of educating our children is falling on everyone. It's not just women, but it's also men, but it's also folks with young families. So I think Charlotte Mecklenburg is reporting that they have, let's see, of their 37,000 students, they have about 14% that are failing, which is an increase of about 7% from that same time last year before COVID. So online instruction still seems to be a problem. The answers from the education community is telling us that just waive oversight. I know they're not doing great, but let's just waive oversight. Don't worry about integrated tests because you can't do it. That's actually a failure, admitting failure and asking us not to ask you for your failure, to recognize that failure. So we have to come up with better systems and how to educate our children. And right now, this online learning is getting better. Again, it's a new system. It's on about March will be a year old, where teachers have had to change their mode of delivery and education. So I do see that they are working hard to get it better, but we're failing our kids, especially those who are in rural populations or in populations that their families are having to work, or in those minority communities where they just don't have that family infrastructure to be able to handle. So we are really going to have a lot of hard decisions coming up in education. I don't personally feel that just waiving testing is probably the best way to do it, because I feel like we need to have a benchmark of where we are so we can only get better. The universities, they're going to have to take a hard look at themselves. I mean, quite frankly, they enjoy sometimes very large budgets. I think UNC Charlotte is a banner. When I say this, I'm not directing this towards UNC Charlotte. I think they do a fabulous job.
And you are an alum, right?
Yes, and I am an alum, but yeah, I am. But they do it right. But we do have universities that really, they have declining enrollment. Their delivery model is online, and we are hearing constant pushback from the payers and users of that system that they're not getting their money's worth. And so is it really fair to charge them full tuition when they're not being on campus? And how does that look towards the future? So universities are going to have to take a hard look at themselves. We saw Guilford College. I mean, they basically dropped several of their majors and went to ones that they knew that they could do and do well, and pared down their faculty. And that's hard decisions, but I saw that in the private community. I think that the university system is going to be asked to do the same. Jumping onto healthcare. So with the latest, I said I want to talk about federal, so I won't, but only in this thing. With the latest change in administration at the federal level, I think what was happening before, I'm not sure will continue to happen. North Carolina passed the Association Health Plan, which is really a good tool. So like community or businesses like the chamber or those who represent professional groups can come together, pool their resources, and bargain and get a better rate for their healthcare insurance. That was been held up in the courts, even though we passed it in North Carolina. I'm not sure what the Biden administration is going to do. That was more of a Trump initiative, so that's still hanging in the balance. I really am disappointed about that, because I thought that was going to be an excellent tool for small businesses to be able to pull together and use their buying power to negotiate lower prices for all employers and employees. So that to me is a big disappointment. Hopefully it will maybe move forward. I just don't know. I don't know where that's at in the courts. Transportation, yay. So I say yay because although I fought really hard to be the chair of the transportation, I also realized that that's going to be a big lift. We heard from the North Carolina First Commission. I don't know if anybody here is on that board, but it was basically a blue ribbon panelist that was directed by former Secretary Trogdon to get together to say, hey, our funding is flawed for North Carolina because it's based on gas tax. And as we know, folks aren't using as much gas as they had to because we have hybrid vehicles, electric vehicles, folks working from home. So that mode of collection of taxes is outdated. And if we continue down this road, we're just going to end up even in a worse spot than we are. So the North Carolina First Commission came out and they had all these wonderful ideas to how to get more money out of North Carolinians to pay for the transportation. But the overarching theme is these are just ideas. The DOT has not adopted these ideas. This is just the commission's finding. One of the things that you hear and you see is this whole idea, and I think it's been up and down the Eastern Seaboard. They're talking about kind of like a pay-as-you-go or tracking of mileage thing, so that which will, if those who use more of the roads will pay more in taxes. It can be collected monthly. In some states, I think Utah, they do it monthly. But the idea that they propose is when you go get your vehicle inspected, they'll check your mileage from last year, and then they will be able to charge based on the number of miles that you drove. That's a way to collect a usage fee based on how much you use. And so those who don't drive don't have to pay as much tax. You can imagine the trucking industry loves that idea. They just love that idea. And actually they don't, I'm being facetious. So, but that is a huge policy decision you're gonna hear in the news and us talking about a lot. I don't know that I hate it. I don't know that I like it. I just know that it's just what we're coming out and seeing how it works. The commission had a study done, and it showed that urban drivers actually pay less right now with the gas tax, because we typically buy fuel efficient vehicles. We don't drive as far because we live near our work. Folks in rural areas pay more because they drive into work, and usually they don't have as fuel efficient vehicles because they like, larger trucks and heavier vehicles, because that's just culturally where they're at. So we'll have a big conversation about how that rolls out and what are we going to do. If they did go to that pay your fee, they would also reduce the gas tax. So I think it's 39 cents right now per gallon that we pay. So it wouldn't be in addition to, but it would be almost like try to level it out so that we'd have a constant funding stream. Another one of their suggestions is, eliminating the dealer exemption. And I'm getting in the weeds here, but there's tons of different ways they want to increase the sales tax. So when you buy a new vehicle, we'd be more on par with Virginia and South Carolina. Eliminate the trade-in exemption. They've just got a whole kitchen sink ideas of how we can, increase that revenue to make sure that we keep it steady. One thing we all agree on, though, is that our secondary roads are in danger. I mean, they are. DOT just went through legislative oversight, and we're continuing to do that. We realized that when they ran out of money, it was not just running out of money, it was mismanagement of the money that they had. So it was really tough to hear. I know you guys like Town of Huntersville and Cornelius and Mooresville. I mean, you do projects, you wait for money back from the DOT and you don't know if it's ever coming. They lose the cost of the job that they were at. It was just absolutely a nightmare. We added some more DOT board positions, or changed them over so that we could get not only the governor's picks, but the General Assembly's picks. We've asked Auditor Beth Wood to go back in and make sure this is working. So they're trying. I don't know that any of these commission's findings, I think the one thing that I was most disappointed about that is that I never heard, how do we make the money we get that we already have spend better? How do we not overspend? How do we maybe incentivize the DOT employees to get these things on time and on budget? Instead of just writing a check and say we need more money. I mean, where are those cost controls? I think that will be my focus on transportation, is yes, I know that we need to revamp this, but we also need to tell the consumers that we are really good at what we're doing when you guys are spending that money. So that's going to be really my focus on that, is just oversight and how we move on from there. Let's see. I do know that, the big thing about electric vehicles and hybrid vehicles, I used to have a hybrid vehicle. I love them. They're great. But that is the one thing that first we'll have the governor come out swinging on any transportation package. So when you hear that kind of stuff and you see this, and folks are very passionate about not being charged because they feel like it's an attack on their choices to be environmentally friendly, but really it's not. It's just saying, hey, look, guys, we collect tax a little bit differently, and it's gases. And so you're using the roads, we're using the roads, and it all needs to be a level playing field. But I'm sure that's what will grab attentions and headlines when we're talking about transportation. So lastly, we're going to hear, and going back to the healthcare space, something I'm kind of really excited about is January 1st should have a rollout of Medicaid Transformation. And Jeff knows this all too well. But in 2010, when Republicans first took over, the Medicaid system was sorely again, mismanaged and $3 billion in debt. And it was just a total nightmare. And that's because it's in large part, because it's like a pay user fee. So you're sick, you go to the doctor, doctor gets reimbursed, and you can go to the doctor all these times and there's reimbursement. So there's no management or understanding of what will be owed each month when they have to write those checks. Transformation is saying, let's look at the whole person. Let's reimburse the providers a set fee to manage their healthcare. And so that hopefully we'll focus more on patient outcome of health than just on the fee for services. Because we all know Medicaid doesn't reimburse at a whopping rate. And you know, so the payer mix for Medicaid isn't lucrative for anybody. So this is just an idea, or a transformation is something that we're going to really look at. So how do we control costs, get better patient outcome, and hopefully be able to move forward. You will again see the conversation around Medicaid expansion again with the new administration. I don't know what that's going to look like, so I'm not going to say yay or no or any of that. I do say that it is probably not the best idea to expand a system when you're transforming a system at the same time. So I don't think that we can walk and chew gum with Medicaid, and so that's why the timing of expansion right now I feel is not good. But I do feel like we have to have those conversations moving forward as we have more and more people who are uninsured. Lastly, what am I working on? Gosh, all kinds of stuff. We have about, we'll know more. We got these 2 weeks off. And so a lot of folks are going around and figuring out what they're going to be, you know, filing and stuff. I've been working in the interim. So, you know, for my legislative agenda, I said I'd never do social issues. Well, I should never say I'm never going to do something, because actually one of my major initiatives and things that I'm working on is raise the age of marriage in North Carolina. It's something that came to me, which was very disturbing. We are having young women who are being trafficked through North Carolina as far away as Alabama. And the reason why is because at the age of 14, if a child is pregnant and with parental consent, they can come in and be married. A lot of times what's happening is that women who are families that are down on their luck, choose to abuse drugs, get financially behind, their only currency are their young daughters. And so they are using those daughters, they're becoming pregnant, they're being basically legally sold into bad situations. So it was striking to me, you can get married at 14, but you can't get divorced until you're 18. You can't file for divorce because you really can't file into a legal contract. So that was one of the things that, you know, that I'm really looking forward to, hopefully getting bipartisan support so we can be on par with other states, and try to, you know, protect some of those young women out there that are being sold, you know, into very bad situations. Let's just say it that way that we're hearing. Also, of course, I'm working with the UNC Collaboratory to get the cancer research off the ground. We had a panel come together. They put a roadmap for North Carolina to be one of the leaders of how do we study or track cancers that tend to pop up around environmental areas. In other words, is it a cluster or not? Because honestly, there is no definition of what a cluster is. And we only as a state react to complaints from people. And when we get those complaints, we're already behind the 8 ball because we don't know what's going on. So this is a system that is going to say, hey, we're going to track these things. We'll be very user friendly. We'll be able to look at them so we can see if there truly is an ocular melanoma or if there really is a thyroid cancer cluster, and we can be ahead of the game instead of behind the game, which we were in Mooresville, and I know Huntersville's done a great job on working in that space as well. So those are two of my, you know, major policy issues that we're going through, but I'm sure there's going to be tons more coming up. But I am talked a lot, so I would like to know, is there anything or have any questions of me that I can try to help answer?
Well, I'm sure we could probably spend the rest of the day with everybody going through things, because you've covered quite a swath of things. Just as a comment more, and happy to follow up on this. One of the things I know the legislature doesn't do when we move from session to session, and as an individual member is working on legislation, that is confidential within bill drafting. And so you could end up having 4 members working on the exact same issue, filing individual bills, and nobody has a clue that they're working on it, and to be able to collaborate. Somewhere that has to change. The other thing that, and I don't know how we address it or the business community help, but the transportation funding issue. least 10 years working on the exact same topic. Multiple pieces of legislation in the past have been drafted, not passed. Same thing with raise the age. That was another thing that's been done probably 6 years ago. So there's lots of things, and it takes a while, as we notice, to sometimes get the attention and change priorities. So those are things process-wise, I don't know how we address, but boy, they have an opportunity as well. I guess I'm going to start with the first thing, and then we'll open it up here in a few questions. I'll take the liberty to get us going on. Since you serve on transportation, and now that you're a chair, you're one of a handful of people that actually has a fairly significant say on the prioritization of things that are beyond the control of the STI. Relative to when we changed from the old equity formula that was backroom deals and who could get their district things. It's a little harder because it's so much data driven. But I know, at least historically, for several terms, leadership in both chambers have set or get to one of the first decision points is to set the overall percentage increase in spending, to put kind of guidelines to frame the appropriations committees of each area of how much they're going to have to be able to allocate. Have you guys had discussions around what that number might be yet?
Yeah, thank you for the question. Let me go back to one thing real quick. You're absolutely right on the bill drafting process. And so I started with my Senate caucus, and I did a old school Senate, I call it Senate swap shop. So we got all into a room, and I gave them 3 minutes. I timed them. I said, go, what are you working on? And what do you need help on? So we have another swap shop coming up next week. And so I am trying to increase communication so that we all aren't working in our different areas and then get hit with these bills that we don't understand what's going on. So I am working on that, but that's not, so I do a radio show on WSIC every day at 11, and the fellow in front of us does an old school swap shop. Call in, tell me what you got. I don't know if any of you are familiar with that. So I came up with that idea that we would do it. So I'm enjoying that. It's actually worked out really well. And we'll continue that communication, which is something that I feel like us as a small business owner brings to the Senate. Communication's key. I mean, it really, really is. And if you don't over communicate, especially your legislative priorities, you can draft anything you want, but it's not going to go anywhere. The corner offices do always decide on that spending level. And I think it's a formula that we try to stick with, cost of inflation plus growth, GDP, and all this other stuff. The House, as you know, historically will always have a higher number than the Senate. Yeah. But in their defense, I mean, there's more of them. There's 120 House members, and they're going to have 120 different requests, if not more. So I completely understand why those are, they always come in a little higher. So that usually is something that the Speaker and the Pro Tem will figure out. And so what I'm telling you is that is way over my pay grade. But we will have that, and you'll see that the governor rolls out the budget. Then the Senate will roll out its budget, and then the House will roll out their budget, and we'll all try to kumbaya and get one passed, because we haven't had one actually passed in totality, in the last 4 years.
And one thing relative to a big issue, and you kind of referred to it a little bit, which is how Ncdot spends money. We've got kind of an issue that's really germane to our area. I don't know how it's being discussed or where, but to the extent you can share, last term Ncdot under the prior leadership, and I think the world of Jim Trogdon, but they went and spent, I don't know, $400 million or some crazy amount of money that was allocated, and they spent it on salaries rather than on projects. Now the ripple effect is, we took the toll road, and one of the aspects of doing the express lanes that we would have these bonus allocations. Now it feels a little bit like bait and switch for our area, that now we're being told, because we gave all these salary increases, now all our projects have been either put on hold indefinitely or at least deferred. Any updates, status, thoughts around that? What's going on? How's that being addressed?
Yeah, so I share your frustration, and that pot of money was given to them because, quite frankly, the DOT was losing their talent. You would have young engineers come in, they would be trained with the DOT, and then private industry would come and take them. So they just had a revolving door. So the intent of the General Assembly, when they, and this is a little bit before my time, was to help DOT retain their talent. Well, the DOT wanted to retain their top talent. And so you saw some folks at the DOT with a 40% increase, and then they pension spiked and left. That's some of the government stuff that's just maddening. The issue with DOT is not the overspend, right? So that was a separate issue. That was a General Assembly wrote the check that was totally different than why well, it's a reason, but one of the different than why we actually are in a delayed status right now. You guys know that the DOT usually lets 444 projects a year. They were coming in asking us with the NC build bond to bond and borrow more money. The treasurer looked at them and said, hey guys, you got $1 billion in the highway trust fund. Use your money before you borrow the next. So they heard that as, okay, you get a bridge and you get a bridge and we're all going to do it at the same time. Kind of like, let's make a deal. Come on guys, who wants it? And so they elevated those 444 projects to 900 projects. We had certain divisions that overspent their budget by 40%. So you saw that they just heard spend money so that you can go borrow more money, and they put their foot in the gas. The problem too with that is just the gross mismanagement. You guys understand how advanced construction works with the federal government, because you guys do it at the town level. You do it with this DOT. Hey, look, I can't wait for you. I know this is coming. We'll front the bill. Just pay me back. Well, Beth found out that it's $4 billion that they had, they could only account for $1 billion of that. So when the federal government was reimbursing them money, they had no idea what project it was going to, and they had no way of telling you, even if they got reimbursed for projects. And I know you guys see that on a fiscal level at the local level and sharing that same frustration. So the money came in, they had no idea where it was going to be accounted to. So you just have an absolute mess. That hopefully, and that's what I'm excited to see Beth Wood. She's going to be auditing them again. Actually voted for her as a Republican. I think she's probably the best state auditor we can have, because she does not pull any punches with the state's money. She will tell you she doesn't care. She's going to be on it. So she's going to have an audit come out again for this last 6 months of the DOT. Hopefully they'll be out in a month or so. We'll see if what they're telling us is actually what's happening. But again, I just have a hard time going to voters and asking them to transform the revenue stream for DOT when they can't transform and prove that they fixed their spending.
A couple of quick things on transportation, and I'm going to open it up rather than jump to other topics, and then we'll come back. Two things, kind of a two-parter here. Obviously, as the chairs, a lot of people won't know, but the chairs and the staff for your committee are the charged with building the budget for transportation. That then gets aggregated, everybody votes on, but it's really a small subset that are spending hundreds, almost thousands of man hours to do that over the next several months. Have you started that process for transportation? And do you have a target when you need to have the first draft of your transportation budget built? And can you share, to the extent what you see are the top priorities you're trying to address within that budget right now that you're building?
Yeah, thank you. We're absolutely starting to talk about that. Once you mentioned before, once we figure out what the spend will be, or what the projected spend will be, which we're going to find out more. We were thinking that we were going to be like, the budget would have like a huge deficit because of COVID. We found out that that's not as bad or dire as we thought it was. So once we have a better, clear understanding of the projected income for 2020, we'll know what to do and get our budget. Yes, we absolutely are starting that process, and it's been going on in the interim about what we need and what the priorities are. Quite frankly, I'm a local girl. I'm all about local. I mean, yeah, I know. That's what, so for me, I am the only transportation chairwoman that is Raleigh West. All of my other board members are east, our chairmen are in the House and the Senate, live in Roxborough, Cumberland, Fayetteville. They're all out east. So when we have a transportation issue that the General Assembly can handle, and you need someone who understands and lives and works and plays in these growing areas, I'm your girl. I'm the one who's there. So I think that and my focus is going to be how yes, I understand we need to, make sure rural communities have everything. But, I grew up in North Carolina where I saw beautiful black ribbons of road being built between Raleigh and the beach while I was stuck in traffic. And I know STIP was trying to fix all of that. There's still some of that going on, not as bad, of course. But for me, it's all going to be about local suburban areas like us and urban areas and how we can make sure to work with our MPOs, be a good steward and see if we can get some more focus here locally. That's it.
Bill,
I'm not ashamed to say it.
Bill got some questions.
Yeah, before we open it up, there are two things I wanted to say to Senator. First off, I think our government response to the virus has almost been as harmful as the virus itself. And I think we're going to see those social implications for the next decade on business. You're already seeing test scores from students going down. Businesses who are struggling and may not recover. I'm not even sure how the virus knows at 10 o'clock at night it could be more potent than at early hours of the day. But all of that being said, again, we need to look at how we're impacting those businesses that are barely hanging on. But I'm also hearing in terms of the vaccine, the bureaucracy we have in terms of the wait times to move through the system. Those vaccines have a shelf life, and we're not moving through fast enough, and they actually can be outdated and go to the bad before we use them if we can't expedite the vaccination process. Can you speak to either one of those two issues?
Yeah, I absolutely agree with the vaccination. So I was looking at the CDC website this morning, and we have been allocated nearly 1 million doses, 969,000 doses. And we've only administered a third of those, 268,000. We've heard stories of how, because we did this vaccination rollout through health departments, local health departments, a lot of people don't even know they have a health department locally or where it's at or what's going on. They're already stretched. Hospitals are stretched, they are giving the vaccines to hospitals, but they're not even fairly giving each hospital or treating each hospital the same. So maybe the hospital with the same, two hospitals like in Asheville, one had similar size, one got 900 doses, another one got 100 doses. So the rollout has been absolutely abysmally handled. Personally, for me, and I've seen in other states, we have and vaccinate thousands of people with the flu by going to a pharmacy. I think we should have done a public-private partnership with this and delivered it that way instead of having these long lines that people can't get through. First come, first serve, no ability to make an appointment. And that's why we I think we only rank above Georgia and I think it was Alabama. So we are at the bottom of the barrel when it comes to this. And so we have to, I don't know, do we throw out that whole system and then go to the public-private partnership? I mean, personally, that's what I'd like to have seen from the beginning. I mean, we have no way to count if you go in to get vaccinated, are you really a 1B or are you a 2A? Or, how do you prove that you're a, firefighter and not someone? So the accountability is not there. And I'm really fearful that we are going to continue down the same path of bureaucracy, and it just doesn't work. I think we've have folks in the private sector could have handled this way better. And I thought it was kind of, quite frankly, arrogant to think that we could build a platform and a whole new system to administer this when the private market already has solutions out there. And so to me, it's actually just a shame. And so we'll continue to sound the alarm. That is governors, and but quite frankly, we can be we can, say all we want, but it is the governor's agency, and that is the agency's decision on how this vaccine is rolling out. So although we can put pressure on them and ask, for better outputs, truly the decision's made over in the executive branch.
Right. Why don't we open it up if there are particular questions from any individual? Otherwise, I'll jump back in for a few minutes, but we've got about 10 minutes or so remaining. Let the senator get back to her job and everyone get back to their business. But any particular questions? Bill, are you able to tell, or if anybody kind of raises their hand, we can see on the monitor? Mayor Iredell.
Hey, thank you for the update on our legislative agenda, and I think it'll be on the league's legislative agenda to help with these road projects, would to basically hold to the fire utilities during the relocation process. It is slowing project. We have a project that's probably 2.5 years behind because we've been waiting, fully funded, waiting on utilities. So just continue with the transportation. And then something that I've been sounding the alarm on, which doesn't seem to be getting on a lot of radars, is pension reform. Been on the state pensions, part of the state pension system for 7 years now. We are one of the best funded in the country, but we're not going to make our numbers over the next 10 years. And it's going to be a significant impact to not only state budget, but also local government budgets. If we hire somebody today, we have to pay about 11.5% of their salary just to match the pension requirements. And it's going up. And they're going to adjust the pension goal from 7% to 6.5%. It's going to be a big nut for everybody over the next few years. We have to do something. We have to change it. The U.S. military's changed theirs. There are a lot of states that are doing stuff to change, to lessen the future liability. So just put that on your radar in addition to the other things. But thanks for what you're doing.
Yeah, no, thank you, John. I completely agree. And State Treasurer Falwell definitely has that as one of his priorities, and and understands fully that that's got to be looked at. But I'm not want to speak for him. He does a great job speaking for himself.
Yeah, Dale's pretty good at that. Mayor Watson, I see you joined. Is there anything in particular from the Cornelius side of the equation you'd like to raise or not?
Well, just very quickly, thank you, Vickie, for all you're doing. We feel like you're ours as well, so, down here in Cornelius, and we really appreciate that. We want to get you a copy of our legislative agenda as well. All of our towns have those, and from an awareness, John has ticked off a couple that's also on ours. I think that that could have some value to you as you know what's important to Jennifer. It's important in North Mecklenburg. It's important to Iredell too. So we'll get that to you, and we appreciate your new role with transportation. We know that's going to make a huge difference, and congratulations on that. And we're certainly going to be calling on you, as we're desperate to get these funds unstuck and moving again. So thank you so much.
Yeah, no, I'm happy to help. And you're right. I think we do have this Lake Norman community that isn't really, it's divided by political boundaries as far as, county lines, but we really are in this together economically. So we share a lot of the same goals. And you guys, I know your local delegation picked up one of our team members again, John Bradford. So you'll have, definitely he's a superstar, and grateful to have him back in the house. Because I feel like he's just sharp. I've known him for, I guess, 20 years now. We did business back when he first started his companies, and just really excited to have him back on the other side. Christy was great too. I personally liked her really well, but you guys know, it is very hard if you're in the minority party to get legislative things done. That's just the way politics are. So I'm grateful to use any resource available to help you all.
Senator, one last question. And it's a topic that hasn't been discussed today. What a lot of people will recognize or may not understand, at least over the last 10 years, every year we battle and court cases that then require, and we continue to redraw district lines every 2 years, which is not what it was the intent. It should be every census, so every 10 years. Well, as we all recognize, the census has occurred, and now it is officially map drawing time. What's the conversation? What's the ebb and flow and the feel around that topic, and what's going on to the extent you're aware?
Yeah, no, thank you for that question. And Senator Berger just was asked that same, so I feel comfortable talking about it. Yes, it has been frustrating, and every few years we're having to redraw these districts. And truly, I think the people who hurt are the folks that are being our constituents, or the ones who get hurt by that, because those who don't just write big checks but need help or volunteer, they get relationships with those who represent them. Well, if that happens every 2 years, then they don't know who's representing them. They can't form those relationships. And quite frankly, I think it's a disservice to those in North Carolinians to continue to redraw these maps over and over and over again. But the thing that puts us ahead of the bar and from other states is that we have redrawn those maps every 2 years. And the last time we redrew those maps were actually based on a Democratic map maker, and it was in public. We saw everything. It was very transparent. Nobody was allowed to work on it unless they were in the committee room, and it was live streamed from that committee room. I think you're going to see that process again. Because really it's very difficult to draw maps because we actually gerrymander ourselves, right? We know that Mecklenburg County has a higher concentration of folks who are registered Democrat. They just tend to live in urban areas. That's hard to draw a Republican district in a, in Mecklenburg County. I mean, that's just, and even if you could, I don't know that you can't, I mean, you just can't. There's certain things like the Stevenson rule that you have to, honor those boundaries of, you have to keep them.
Right.
Yeah. So, I mean, there's only so many ways you can redraw those lines. And it truly isn't some political fat cat sitting in the back room going, I wanted to protect my buddies. I mean, it really does go with the census and how it works. So I think you're going to see that same map drawing process again. The interesting part probably won't be our state level folks. It's going to be congressional. If the census comes back to the way everyone says it will, we might pick up that extra congressional district. We've already got people running around the building saying they're going to run for Congress in that new district. And I think you'll see some more of that coming out. So census is due spring. So we'll probably start doing those lines this summer, hopefully be done. And because we just redrew them, that's again, I don't see much changing in the state level.
Great. Well, it's about that time. We appreciate you again taking time out of your schedule. Obviously, we're not only blessed to have you here locally serving the Lake Norman area and taking care of us as citizens, but I think the whole state's going to benefit from your leadership and what you do. With that, again, I thank you, Vickie, for being here, and Senator, we will stay in contact as a collective body and the issues from the communities. One thing to mention that you mentioned a couple people, the next couple of Focus Fridays, the next month, we will actually have Chief Justice Paul Newby will be here talking about the court systems and update. The following month in March, we'll have the area leadership from the CRTPO, the MUMPO groups and stuff, and a panel from the technical staffs as well, going through the priorities in that process, talking about road and transportation priorities in March. And then in April, we have Secretary Mandy Cohen. So Dr. Cohen will be with us and talking about at that point, getting a detailed update and see what the issues are around the vaccine process. So that's our next few Focus Fridays. Bill, with that, I'll turn it back to you.
Yeah, and speaking of the vaccine, on this coming Tuesday, we have a special Business Works, and we have Holly Davis talking about COVID-19 and how the vaccines are impacting business. So many of you may know Holly Davis. She is a Huntersville resident. I got very involved with the dog tethering, and so she created Holly's Hope, but she's really in the HR field. And so she's going to be talking about how the rollout of these vaccines are going to impact our economic climate. So I hope you can join us for Business Works. It is this coming Tuesday at, I think we scheduled that at 10 o'clock to 11 o'clock. And you can get information on that on our website. We also have a very special briefing on the 28th. It's going to be on the PPP, the rollout of the next PPP. We have Dale Gilmore, who's going to be speaking to that issue, and we got kind of a panel discussion. That's taking place again on the 28th, and there's more information on our website about that. Those are two upcoming programs. We've got a blood drive this month. We encourage, if you're somebody that would consider giving blood, please consider. I think we have a blood drive this month, and one that that our organization, the Chamber of Commerce, is sponsoring in February. So we have that as well. And for those who have recently joined the Chamber, Vickie, one positive note is even in the light of the pandemic, our Chamber, we had I think 138 new businesses join the Chamber of Commerce last year. That's just spectacular. While yes, we're still having businesses hanging on, and while we lost some, We had a lot of new members join the chamber, and we're going to have a new member orientation this coming week. Again, all of these things are on our website at Lake Norman Chamber of Commerce, lakenormanchamber.org. So again, thank you, Senator. Thank you, Jeff. We want to thank our sponsor, Novant Health Huntersville Medical Center, for being the presenting sponsor, WSIC, which you mentioned, Vickie, and you have a show on. Tell again, you want to plug your show? When is it?
Yeah, so Fridays at 11 on WSIC, which is 100.7 FM, 105.9 FM. It does reach the North Mecklenburg area, but I do have a North Carolina focus. We talk about what happened at the General Assembly, and I'd love to have you guys tune in.
WSIC is a great partner of ours, as is Cornelius Today. Business Today is another one of our sponsors. So again, thank you everybody for joining us today, and have a great week. Have a great weekend.
Thank you.